Hi friends, I think in my last video I did a very short introduction and I wanted to give a little bit more of information regarding why I'm starting this channel. I'm basically doing it to connect with people and vent and explain and get as much information as I can get and give as much information as I can get regarding chronic illness. In my case, which is probably in many people case, I have a lot wrong, and like I said in my last video, I was in the hospital. I had 2 infections that after going to urgent care, they gave me prescriptions. They didn't do a great job. So after being on antibiotics for those 2 infections, it wound up turning into sepsis. And I didn't know that until I got very ill. So I was rushed to the hospital, 103 fever, diagnosed with sepsis, and stayed in the hospital for a few days. Was on 7 antibiotic drips, which I'm sure anybody that's had sepsis knows they hit you with what they call the big guns, which is vancomycin, and a whole bunch of other, about 7 antibiotics. And I had pneumonia, which I developed, and wound up with a collapsed lung and deflated lungs bilaterally. But after a little under a week, they discharged me. They explained that since my oxygen level had improved, it was better that I would be home and on antibiotics and treatments there because it was safer. Makes sense, but it kind of feels like they want to get you in and get you out. But that's what happened. And after about a week of being on the antibiotics, I got very sick again, nighttime fevers, so on and so forth, and back to urgent care, back to the hospital, and it's just been crazy since then. And this is all new. This is not even part of the chronic illness. This is just something that hit on top. So anyway, to get back to what I was saying was I was going to list my diagnoses that I am being treated for, that I see doctors for on a regular basis, and I take medication for everything. It's a long list, but I wrote it down so I could try and remember. So if I look down, please excuse me. Okay, so I believe I said in the last video a few of these, so if I repeat myself, again, I apologize. But I have 2 aneurysms. They have not ruptured in the brain yet, so every 6 months I get an MRA, which is an MRI, but it's also of the arteries in the brain to check the arteries. I also have an ultrasound of my carotid arteries, my neck, with that brain surgeon. because I have blocked arteries, which can affect the aneurysms. So I do that every 6 months, and everything has stayed stable, meaning that they haven't gotten big enough to take a risk to do anything with, and I'm fine with that. I think because they don't cause me symptoms on a daily basis is probably why one of the most scariest things doesn't scare me. I know that if anything happens and they rupture, I'm not going to know, and I'm okay with that. So everything else, though, is symptomatic pretty much on a daily basis. Then, next on my list is after the pneumonia, my asthma has come back, or COPD. I had petit mal seizures, more of a kind of staring off seizure. I forgot the name of it, but it's kind of like the lights are on, but nobody's home. They don't happen often anymore. Last year, 2 years ago, it happened for about a year, and for a year, you can't drive. So I take medication for that. I also have a ton of GI issues, which I've had for 20 years now. I have IBS, diverticulosis, gastritis, and dysphasia. The dysphasia is when you can't swallow, and that was because I had neck surgery about 5 years ago. I had C5 through 7 discectomy infusion. They removed 2 discs, one of which was broken off, and they put a titanium plate and screws, and because the surgery took so long, you have a breathing tube, and that caused the dysphagia. But after about a year of eating food that was basically liquid, and then I went to mushy food, and now I'm on regular food as long as it's chopped up real small. But I choke every day anyway, but that's fine. I also have a motility issue. They had done that test. I don't know the name of that either. I'll have to look that up, but it's where they make you swallow a pill, and the pill releases all these little camera likes, and you go back every day and they take x-rays of your stomach and to see how long it takes for you to get rid of them. So I didn't pass that, so that's an issue. I have pelvic floor disorder. I have hyperlipidemia. I have hypothyroidism. I have back problems, bulges, and I also have neurology issues, just so you know. It's frontal lobe disorder. It's mild, but it's where they consider it problem solving, which just means I can see the words in my head. I just can't get them out, so that's what just happened now. I had broken my arm, and it had to be casted, and after they took the cast off, I developed RSD, reflex sympathetic dystrophy, which is also known as, that's something that happens, unfortunately, semi-often. I have a problem with tripping and falling and walking in a good way. So my husband is usually, he's my crutches. I hold on to him, he holds on to me and helps me, which is fantastic. And I'm getting better, at least in the sense of after the hospital that I just dealt with the sepsis that threw me down even worse. And now I'm at least getting back to where I was before the hospitalization. So that wasn't great, but I was able to walk and I was able to drive locally. So we're aiming to get to that place, and I hope we get there soon. And so that's a lot, I know. It really is. It's a lot to take in. It's a lot to deal with when it comes to family. And I'm sure a lot of people go through this, where you don't want to be a burden on your family, but there's nothing you can do. You wake up every day, and every day it's something different. Meaning that you can have all of these things wrong with you, but maybe one of those things is more intense that day. And sometimes there's an emergency that day. And unfortunately, it's real hard because you can't help but feel guilty. You feel guilty for your family, that they have to be responsible for things that I can't do. My husband, for instance, he has to drive me almost at least twice a week to some sort of doctor, because I have so many follow-ups that I go to, and labs, because I have to have blood cultures done. And he works hard. He gets up at 3 in the morning to go to work. He's a sanitation worker, and he's got it hard. And then he has to come home after he stops and does food shopping and all that kind of stuff, and maybe get an hour nap in before he takes care of me and cleans and cooks, because I can't stand long enough to cook. Not that I'm complaining, because he's an amazing cook and I don't have to do it. But sometimes it's real hard to think about. I don't talk about it really with family if I can avoid it, because to tell somebody every day that something's hurting you, that you're in pain, it just, I don't know, it just doesn't feel right to me. It's hard, it's embarrassing, I find, for myself, and it's something I know I have to work through, but, you know, it's been the last 5 years, so if I haven't worked it out in 5 years, I don't know, but we'll get there. You know, maybe you guys will help me with that and have some advice. with that, but you know, nobody signed up for this. I know it's not my fault. I know I didn't ask for any of this, but it is what it is. And it's sad. You know, I have a daughter. She has to live a life with a mother that wasn't like this and was very strong and had her own business and took her everywhere and did everything with her and loved it, but can't do that anymore. And she's so good about it and so caring about it, but you can't help knowing that she feels bad and she's scared and she's not wanting me to be like this, but that's the way it is. So I think in the next video I'm going to probably show you all of my over-the-counter and my prescriptions, medications that I take almost on a daily basis, because it's a lot. And maybe you guys will relate to it. Maybe you guys are taking some of the same things, or maybe you'll find something that will help you guys. So I'll say goodbye for now, and God bless everybody, and I hope anybody out there dealing with any of this, one thing from this, it doesn't matter how many you have going on, diseases, but even just one, it's hard when it's chronic. And I hope you have someone to talk to, and I hope you have a good support system. And hopefully that's what I can build here, is a support system for myself, for you guys, and I really look forward to it. So until the next video, bye.